Hi, I'm Dr. Anubha Singh. I'm the consultant Reproductive Medicine and Assisted Conception at Bensups Hospital. All my training has been in UK. After doing my MBBS, I went to London. My training in Obstetrics Gynecology and Assisted Conception has been in some of the best hospitals in London. I recently been back for 6 months, and people are getting prepared. And media has been a very important role. They are reading lots of articles every day, newspapers and day-to-day television. But still, we are lacking behind. There's not a complete information which I could see and among couples. There is a bit, but not complete information about the fertility treatment. So we need to give some more information among community.
How many times can a woman take the IVF treatment?
Again, we have to assess why the IVF treatment fails. Say if the patient undergoes one IVF treatment, we need to assess detail what went wrong. Was there any problem with women? How were the quality of eggs? How many eggs were collected? What were the quality of embryos? What was the quality of sperms? And depending on that, we advise for the second IVF cycle, if we have to plan, so that we can amend any problems there. And sometimes the patient, we could figure out that even the first IVF treatment may not work. It's very poor ovarian reserve, they don't respond. So she can't go ahead with the second IVF treatment. So it all depends what we find. But if you ask me, I need 3 to 4 IVF treatments. I think it's more than enough to give us an answer whether it will work or not.
And what is the usual age up to which?
Yes, up to age of 42, 42 with her own eggs. But after 42, if she tries with her own eggs, the chances of conceiving it is quite low, because as the age advances, the ovarian reserve comes down. So after 42, usually I advise for egg donation. But again, we have to assess with the patient's ovarian reserve, and everything comes into play, or what the individual profile is, the hormone profiles and everything, and then we decide.
What is the success rate of this treatment?
It varies. It depends upon what is the cause of infertility. So, but in general, if you ask, it's around 40%.
Who should, according to you, take this treatment?
The patients are a couple who have been trying for baby for last, say, 2 years. They are unable to conceive. They should go and seek treatment to their expertise. What I will suggest, they should go and see a fertility center rather than going through general practice gynecologist, because they may lose time, because women's age is very important.
And what are the investigations required?
So when the patients, they come to us, we take a detailed history from both couples. So it's the men as well as women. For women, we have all the hormone tests done. We do ultrasound pelvis. Then may require tube test, which is a fallopian tube patency test, we advise. For the husband, we advise for semen analysis, and depending upon the findings, then we decide the treatment. If all the hormones are normal or within normal limit for the patient, for women, and husband's semen is normal, we will try for the minor treatment, which is called as intrauterine insemination, or in general IUI. Or if we find any kind of problems in the sperm, or from the women's side any problems, we may suggest IVF. So it is all depends on what
is the time gap between 2 IVF treatments that a woman should ideally maintain?
The gap, what I normally advise to my patients, is at least 2 months gap between one IVF and the following treatment, because in IVF treatment we give quite high doses of medications. So all the hormones need to come down to the baseline before starting another treatment. So 2 months gap minimum. Ideally it will be 3 months, but 2 to 3 months is fine.